Most people think of Sjögren syndrome as just dry eyes and dry mouth. That's the surface. But here's the urgent truth. The disease doesn't stop there. It reaches into the nervous system. Silently, slowly, and often overlooked. And once the nerves are involved, the consequences can be life-changing. That's why we need to talk about the neurological side of Sjögren's. Because if you catch it early, you can prevent years of suffering. But if you miss it, the damage may be irreversible. Imagine this: a patient walks into a clinic complaining of burning feet, numb fingers, or sudden dizziness. The doctor thinks maybe it's diabetes, maybe it's stress, maybe it's just on their head. The tests come back inconclusive, so the patient is sent home with painkillers or reassurances. But the weeks pass and nothing improves. The symptoms worsen. Walking becomes harder, balance feels off, and even something as simple as buttoning a shirt becomes a challenge. Eventually, after multiple visits and referrals, the truth emerges. It's not anxiety, not age, not imagination. It's Sjögren's quietly attacking the nerves. By the time that realization comes, precious time has slipped away. This is the cruel part of neurological involvement in Sjögren's. The immune system doesn't wait while doctors debate. It keeps chipping away at the nervous system, one fiber at a time. Unlike the salivary glands or tear ducts, which can compensate to some extent, nerves don't bounce back so easily. Once the damage is done, the signals that carry sensation or movement or even the automatic rhythms of the body can be permanently disrupted. This is why the neurological side of Sjögren's is so dangerous. It hides under vague symptoms, it mimics other conditions, and it fools both patients and doctors into thinking it's something less serious. And in that delay, the disease gains ground. Every month, without an answer, means more nerve endings lost, more electrical pathways broken, more quality of life taken away quietly in the background. The urgency isn't just about naming the disease. It's about recognizing that when nerves are under attack, the window for intervention is small. Acting too late means living with consequences that medicine can't fully reverse. That's the part that makes neurological Sjögren's so devastating, not just the pain itself, but the missed opportunities to stop it before it becomes permanent. The nervous system involvement in Sjögren's comes in many disguises. It could show up as peripheral neuropathy, where the patient feels pins and needles in the hands or stabbing shocks in the legs. At first, it might be brushed off as poor circulation or a vitamin deficiency. But the sensations don't fade, they spread, and they interfere with walking or even sleeping. In other cases, it isn't the body that gives the clue, but the brain. A person may forget simple words, lose focus halfway through a task, or feel like they are moving through mental fog. To friends and family, it can look like stress or worse, early dementia. Then there are the more dramatic presentations. Some patients develop sudden weakness in the limbs or inflammation along the spinal cord that steals mobility overnight. Others experience unexplained seizures or vision changes. Events so unusual at Sjögren's rarely makes it onto the first list of suspects. That's what makes it so elusive. The disease is a master of disguise. It imitates multiple conditions, each with its own typical path. So doctors chase one lead after another, never suspecting that an autoimmune process is connecting all the dots. While the symptoms are scattered and confusing, the damage is not random. It's the same immune system attack, targeting different parts of the nervous system. What looks like unrelated complaints is often the same underlying storm. And while the focus is on each symptom in isolation, the real culprit keeps progressing silently, carving away at nerves in a way that only becomes clear much later, when the pieces are finally put together. Now here's the biology. In Sjögren's, the immune system loses its sense of direction. The very cells designed to protect begin to confuse the body's own tissues for invaders, and the nerves often get caught in the crossfire. Small fiber nerves, the delicate strands that let you feel heat, cold, and pain, are stripped down by this misguided attack. The result is a constant burning, stabbing, or tingling that doesn't stop when you rest and doesn't heal with time. It's like living in a body that keeps sending alarm signals even when there's no danger. The damage doesn't stop there. The autonomic nerves, which are the hidden wiring behind every automatic function, also fall under attack. These are the nerves that keep your heart steady, regulate blood pressure when you stand up, and move food through your intestines without conscious thought. When they falter, a person may feel dizzy every time they rise from a chair. Their heart may race for no reason, or their digestion may slow to the point where eating becomes uncomfortable. These symptoms may look scattered, but they are linked by one cause: the immune system breaking down the communication system of the body. This isn't just about discomfort or inconvenience. When the wiring that runs the body short circuits, the signals between brain and body lose their clarity. Simple actions like walking across a room, focusing on a conversation, or even keeping steady blood pressure can become unpredictable. The biology of Sjögren's isn't only about dryness. It's about the gradual unraveling of the body's control system, one nerve fiber at a time. But here's where it gets tricky. The neurological signs of Sjögren's often sneak in long before the classic dryness ever appears. Someone may go to the doctor for shooting pain down the leg, convinced it's a pinched nerve or sciatica. Another person may struggle with constant migraines or a cloud of brain fog that feels out of place for their age. A woman in her 40s might think her memory lapses or fatigue are tied to hormonal changes. None of these experiences seem to point toward an autoimmune condition, and so the possibility of Sjögren's rarely enters the conversation. Even physicians trained to connect patterns often get anchored by the stereotype. Sjögren's equals dry eyes and dry mouth. That's what the textbooks have drilled in. So when a patient walks in without those hallmark complaints, the diagnosis drifts toward more familiar labels like neuropathy from diabetes, tension headaches, or age-related memory decline. It isn't negligence, it's the blind spot that comes from thinking of a disease too narrowly. This gap between what the disease actually does and what most people think it does is where patients fall through the cracks. It's why so many are shuffled from one specialist to another, never getting a clear answer. And it's why studies show that the average patient with Sjögren's waits more than 7 years for a diagnosis. That's 7 years of immune cells quietly dismantling nerve fibers, 7 years of symptoms that worsen while explanations fall short. 7 years where intervention could have slowed the damage but never arrived. So what can be done? The answer isn't straightforward, but it always begins with awareness. A doctor who hears about numbness, burning sensations, or unexplained dizziness has to think beyond the usual suspects. Ordering only basic blood work won't always tell the full story. In many cases, nerve conduction studies are needed to measure how well electrical signals travel, or a skin biopsy to look at the small nerve fibers under a microscope. Sometimes even brain or spinal imaging is necessary to uncover inflammation that isn't visible any other way. Without these deeper investigations, Sjögren's can slip past unnoticed. Patients also have a role in piecing the puzzle together, recognizing that nerve symptoms combined with subtle dryness, fatigue, or joint pain might point to something autoimmune can change the direction of their care. If a person sees multiple specialists for years without answers, pushing for a broader evaluation can make all the difference. The earlier Sjögren's is uncovered, the better the chance of slowing the neurological damage before it becomes permanent. Treatment isn't just about suppressing the immune system. It can also involve adjusting lifestyle to reduce triggers, managing pain carefully without masking the underlying issue, and supporting the nervous system with therapies that maintain function. Each step matters because once nerves are gone, the body doesn't rebuild them easily. Early recognition doesn't promise a cure, but it opens doors to therapies that can preserve quality of life, stabilize symptoms, and keep patients from sliding deeper into irreversible damage. And here's the empowering piece. Even though there is no cure yet, neurological decline with Sjögren's is not written in stone. Patients who pay attention to their bodies, who ask the right questions, and who don't brush off persistent symptoms can change the course of the disease. The nervous system may be delicate, but it also has remarkable capacity to adapt when given the chance. With early recognition and proper treatment, nerve damage can often be slowed before stabilized but spirals out of control. Pain, though difficult, can be managed through a mix of medical therapies and supportive approaches that keep daily life more livable. Autonomic symptoms like dizziness or gut problems can be improved once the underlying cause is understood and strategies are tailored around them. Even cognitive fog, while frustrating, can often be lessened when the immune attack is brought under control. The urgency here isn't about fear, but about encouraging action. Sjögren's doesn't have to strip away years of quality living if it's confronted early. The difference lies in awareness, persistence, and timely intervention. When it comes to the nervous system, time isn't just valuable, it is the medicine that preserves what cannot be replaced.